Hey guys, Miss Hill here, and we are going to talk about individual module 7, where we discuss oxygenation and sudden infant death syndrome specifically. Here are your learning outcomes, and you guys can read over those on your own. So let's get to it. First of all, we have to understand what SIDS is. And SIDS is a sudden death of an apparently healthy infant that remains unexplained after other possible causes have been ruled out, such as any kind of illness, homicide, those types of issues. SIDS is the third leading cause of infant mortality in America, and it mostly occurs in babies that are 2 to 4 months old. So it can occur up to when a baby is 1 year old, but we see most cases in that population of 2 to 4 months of age. We don't have any really confirmed causative factors that tell us that SIDS is going to happen, but there are some theoretical etiologies that we have to keep in mind and that researchers have found that contribute more heavily to those infants who die of SIDS. And so here you see listed the 3 factors that occur simultaneously for a baby who dies with SIDS. There's a theory that there's this brainstem abnormality that controls our respiratory and our autonomic system whenever we're infants. And it doesn't work so well, for lack of a better word, in newborns. So they don't have this protective reflex that they need for whenever they're laid down and they become asphyxic or they stop breathing, to lift their heads up and turn one way or the other so they can breathe again. They don't wake up whenever that happens. Unlike you or I as adults, if we experience asphyxia, our body has a protective reflex to attempt to correct that situation. So newborns are thought to have some type of brainstem abnormality that doesn't allow them to do this, putting them at a greater risk for SIDS. Also, it's found that body positioning also plays a big role in newborns dying of SIDS. So that's why we teach back to sleep. We teach moms and dads and family members not to lay their babies on their tummies or on their sides to sleep. And then there's also this critical developmental age from about 0 to 6 months. So their first 6 months of life, where they're kind of developing this these protective reflexes in terms of their brain, and just developmentally they're not able to protect themselves as well when they're less than 6 months old. When a baby dies of SIDS, there is always an autopsy done. And what those autopsies usually show are that these babies have blood-tinged and frothy secretions from their mouth and their nose. There's oftentimes a shown struggle or attempt for them to change positions. And then also this syndrome is associated with sleep and no suffering. It's unpredictable, and truthfully, it's unpreventable. So your job as nurses is to teach ways to help parents and families prevent this through education and preventative measures. So here is some of the current SIDS research. And here you can find sort of those three factors that we just talked about right here. So we have this critical development period that we just talked about. 90% of all SIDS deaths occur between that 0 to 6 months of age, so that critical development period. And then you can see we have that big peak between 2 and 4 months, like we just talked about. We also have an infant who's vulnerable, so that's that brainstem abnormality. Babies present with a subtle defect that can't be detected at the time, and they don't have that protective reflex in terms of their respiratory system. Also, there are outside stressors, so something that the infant can't help or can't respond to, something they're vulnerable to. So here you would think about things like upper respiratory infections, the kind of environment that they sleep in. Babies can't control where they're put to sleep or how they're put there. So they can't control if their parents smoke, which is another big risk factor for SIDS. So we have these outside stressors that also contribute. And here's a chart just to sort of show you that right here in this 2 to 4 month age range is whenever you see that highest peak for babies that die from SIDS. After that 4 month range, it really drops, it decreases, and then even becomes less and less after that 6 month period or that critical development stage. And then, as I'm sure most of you know, the biggest thing that we teach to help prevent SIDS is back to sleep and tummy to play. And if you look at this chart, it truthfully shows that there is an extremely heavy correlation between beginning to teach that back to sleep and a decrease in the risk of SIDS. So look all the way back here in 1983, when I was born, and parents back in this time did lay their babies down to sleep on their tummies. They thought that it actually helped the babies sleep better. Some of them thought that if they fed them a bottle and then put them down on their stomachs to sleep, that they wouldn't throw up and not be able to get that out of their mouth. But we know now that that's not the case. So when all this research was being done on SIDS around this time, and we started teaching back to sleep, you can see that the babies who were laying on their stomachs decreased drastically as we began to teach that in the hospital and to emulate that behavior to parents. So here's your SIDS rate. The death rate decreases dramatically along with parents learning to put their babies on their backs to sleep. So let's talk about some risk factors. We've already said a couple of them. Prone or sideline positions are a huge risk factor for SIDS. So we are very careful as nursing staff in pediatric and maternal child facilities to be sure that we emulate the correct behavior of placing babies on their back to sleep, placing them in a separate area to sleep, not in the bed with mom. We're very careful we don't lay them on their sides, and we make sure that we always tell parents and families why we're putting them in the position we put them, which is on their back. Low birth weight babies, pretermers, and small for gestational age babies tend to have a higher incidence of SIDS. And if you think back to some of our newborn lectures where we talked about the respiratory issues that low birth weight SGA and preterm babies have, you'll recall that they don't have as great respiratory protectiveness that normal babies have. So for example, that small for gestational age baby or that low birth weight baby, they don't have the same type of musculature that a normal newborn would have in terms of their respiratory system. They're also prone to get more respiratory infections, which is another risk factor for SIDS. And pretermers specifically have that lack of surfactant that we talked about. And and they also have more apnea than a normal newborn has. So those are all things to consider and keep in mind when you're caring for this population. Tobacco exposure and substance abuse prenatally will put newborns at a greater risk for SIDS. So we need to make sure that we're teaching smoking cessation along with our back to sleep for those moms who are tobacco users. And it doesn't matter if it's first or secondhand smoke. So you can smoke in the same room with a baby, and that baby has just as high of a risk of SIDS as the mom who smokes out on the porch. Because what happens is still that smoke gets trapped in her clothes, and when she comes back inside and she holds the baby, that baby is exposed in a secondhand manner almost, and puts it at the same risk as a mom who smokes right there in the bedroom with her baby. Loose and soft beddings are a no-no these days. We teach no bumper pads in the cribs. We teach no extra blankets, no stuffed animals, no pillows. Babies really need to be on a flat, firm mattress, separate from any other sleeping individuals in the home, and they need to have a tight-fitting sheet. If moms and dads are worried about the babies being cold, they need to be in a sleeper, something that will keep them warm so they don't have to be covered with an extra blanket. Also, overheating is a risk for SIDS. So another thing we teach to moms and dads is to keep the room temperature comfortable for what an adult would be comfortable with. We always have this theory that babies tend to be colder than we are. And that's not necessarily the truth. There's no need to bundle a baby up when the room is 80 degrees. Your room should be somewhere from 65 to 72 degrees. What would be comfortable for a grown-up? Families who have a past history of SIDS, who have lost a child before, they're at a greater risk for subsequent newborns to pass from SIDS. People of low socioeconomic status. There are certain races who are at a higher risk, specifically your American Indians, your Alaskan Natives, and non-Hispanic blacks are at the greatest risk for newborns who die with SIDS. Males tend to die more than females in regards to this syndrome. And then co-sleeping, we know, is a huge no-no. So putting a baby in the bed between mom and dad or with other siblings will put that baby at a greater risk to die. On the other hand, breastfed babies tend to have a lower risk of SIDS, and the theory there is that they're more easily aroused at night, probably because they're hungry. Their food digests a little more quickly than formula-fed babies. And they are just more easily aroused from sleep. So maybe, in theory, possibly they have a better protective reflex. Also, pacifiers have been shown actually to help babies wake up a little more easier as well. So offering a pacifier at sleep time can also help decrease that risk of SIDS. The bad thing is that there are no warning signs for SIDS. Parents don't know it's coming. Healthcare providers don't know it's coming. The very first symptom of SIDS is cardiac arrest. And oftentimes that is not even witnessed because the parents won't actually find the child until the next morning or several hours later after the baby's already died. So what are some nursing diagnoses that you should consider whenever we're thinking of this syndrome? Well, risk for SIDS related to a past history, because that definitely puts people in a category where we want to pay really close attention in terms of education and letting them know things they can do truly to prevent this from happening to them again. Knowledge deficit related to the risk factors. Knowledge deficit related to preventative measures. So that's your grandmother who wants to put the baby on his stomach to sleep because she doesn't want him to spit up and choke. It's really important that we have to kind of educate that more older population as well. So not just mom and dad, but we have to include family members. Fear of a repeated occurrence in the future. Moms and dads who have had a baby that this has happened to in the past are extremely fearful that it will happen again whenever they have another baby. So it's important that we try to help ease their mind, but also teach them ways that they can help prevent this. Grieving related to the loss of a child due to SIDS is also another nursing diagnosis that you might want to consider for the family that you're caring for who has lost a child with SIDS. And it's important to note siblings in this category too, because as we learned previously in class, children at certain developmental stages tend to have this magical thinking about death, right? About grief and loss. And that magical thinking can lead them to believe that deaths are their fault. So maybe they had a bad thought about their brother or sister, and now they believe that since the babies died from SIDS, it was their fault because they had this bad thought. So it's important that parents understand that if they have other children in the home that are around that developmental stage, so they can help those children sort of work through the grieving process as well. Also, those children might fear that they're going to be next because they don't really understand what's happened. So it's also important for parents to understand that they may have some fear surrounding the death because they feel like it's going to happen to them. So what can we do? Well, if a loss occurs and you're taking care of a family who's had a newborn who's died from SIDS or an infant, make sure that you're empathetic. We have to be empathetic for these people. We have to be supportive of the family, and we have to reassure them that they are not responsible for the death. Those are things they really need to hear. And we can direct them to support groups, but oftentimes SIDS is such an acute process. It's not like having a child die from cancer where you can begin that anticipatory grieving process and sort of work through some things. It happens all of a sudden, out of nowhere. And these people have a very acute grieving process. So we have to be very careful about how we offer support to them when they're in the hospital. Oftentimes they don't want to take that support from us, but the best thing, and if they don't, that's okay. The best thing for you to do as a nurse is to maybe make a follow-up phone call to those people and encourage them, but don't be pushy about having them go to support groups. So for those individuals who have not lost anyone from SIDS, those ones that we are trying to educate, that's the biggest thing intervention-wise we can do for them, is focus on prevention. We want to assess risk factors that are associated. We want to teach preventative strategies. If we can, include CPR. If they have a positive history for SIDS, institute emotional support interventions. If they have a positive history for SIDS in the past, it would be extremely important to try to get them into a CPR class so they would understand how to initiate that at home should they find their new child in that same position. We can provide resources for them to get apnea monitors to be used at home. They have these really, with all the technology we have now, they have all these really cool devices that are like little socks, almost like little O2 sat monitors that you can put on the baby's foot, and you can download the app on your Android or your iPhone, and it will tell you if your baby stops breathing. So the technologically advanced population that we take care of now, especially younger mothers, that would be something they would be really interested in. So we need to know where to direct them for things like that. One of them, the most popular one now, is called the Owlet. We got to assess their history and their events prior to the discovery of this situation. And we should definitely expect some somatic symptoms that accompany their grieving. So, like I said, it's an acute grieving process. So if a mother comes in with a baby this way, you may find that she's extremely fatigued, she's hysterical, she could have nausea or vomiting, she could pass out. So those are things also to keep in mind. And then here you see a question at the bottom: why is an interview or investigation required to be done following SIDS, and what information needs to be documented and why? Well, we said at the beginning of this PowerPoint that an autopsy has to be done. But before that, we've got to have law enforcement rule out any other types of causes of death, because that's how we get our definition for SIDS. We have to rule out all other causes. So it can't be a clinical cause. The law enforcement people have to rule out that it's accidental. They have to rule out that there's homicide involved. And to do this, they actually have to go to the home. They have to look at the scene. They have to describe the scene and look at fixtures and the appearance of the body, where it is. They have to take a history, a health history, a birth history, determine if there were any birth defects, get the maternal history, the prenatal history. So all of those things are done in an interview fashion and an investigation, just like it would be for an adult who died at home with no apparent reason. And those things are done by your medical examiner and your law enforcement officers. So what do we expect? We expect that a family can verbalize and understand what SIDS is and the different preventative measures they can take once they arrive back home to prevent this from happening to their family or their baby. We want them to not only verbalize and know those preventative measures, but we want them to adopt those preventative measures, which is one reason why it's very important as healthcare providers that we emulate those preventative measures in the hospital. Kind of a see one, do one situation. It's important to get moms to think about attending CPR classes and demonstrate competency if they decide to do that. And if families who have lost a child before are being cared for, we want them to cope effectively positively, and we want them to utilize the community resources that we provide for them. So here's some of those preventative strategies in a nice little chart for you. Definitely put your baby on its back to sleep. Put your baby in a crib for nap time and bedtime and any type of sleep time. Use a firm mattress with a fitted sheet. Put your baby's crib in the same room as your bed so we can room share, but don't bed share. Breastfeed your baby. Use a pacifier. And keep your baby's immunizations up to date. And the theory there is that if we keep their immunizations up to date, we can avoid respiratory infections that put babies at a greater risk for this. What we don't want to do is put the baby on her stomach or her side to sleep. We don't want to use a car seat or a swing or a bouncy chair, anything other than a crib for the baby to sleep in. So it's important to educate moms and dads that just because your baby sleeps better in the car seat, don't use that as a place for them to sleep at night or at nap time. Don't use extra blankets or pillows or bumper pads. Don't sleep in the same bed, so no co-sleeping. Don't use sleep positioners, so those little things that go on the baby's sides that keep them from rolling over. Actually increase risk for SIDS. Don't hang the pacifier around your baby's neck, and don't smoke around your baby. So just another little slide here for you to read through. Most of these things we have talked about throughout this PowerPoint. The biggest thing for you to remember is back to sleep, tummy to play, and to make sure as a healthcare provider that you're teaching the preventative measures, that you can recognize the risk factors in individuals that you take care of so that you can focus greatly on teaching those individuals preventative measures, even above and beyond individuals that we have to teach everybody, but if you can identify risk factors, you can really hone in on those individuals that really need greater teaching. And there are your references. Thank you for watching.